Howdy friends, it's your City Manager Seth Sumner with you once again for your daily COVID-19 update. It is May 4th, 2020, and of course we'll start with the Tennessee Department of Health data. Looking at this new dashboard that we've been looking at for about a week now, where we can really easily show you that data set from the Tennessee Department of Health. We are seeing 13,571 total cases from the onset of this pandemic now. That is an increase of 394 since yesterday. It is now thankfully looking at 6,081 Tennesseans fully recovered. We are seeing an increase of 267 from yesterday. Total Tennesseans hospitalized is 1,143, which is a slight increase of only 8 from yesterday. And now a number that we've been talking about for a while, looking at the total amount of Tennesseans who have been tested. Those are at local health departments, those are through primary care providers, some hospitals, and it's also through those drive-through testing assessment centers that are being set up through health department, regional health departments, and the health of the Tennessee National Guard. We hosted one here in McMinn County a couple Sundays ago. We had 334 come out for that. There was one in Bradley County this past Saturday that we let our viewers know about. But now 211,443 Tennesseans being tested for COVID-19. That is an increase of 6,836 since yesterday. Let's go over to our next dashboard that covers McMinn County. Where do we stand right now? McMinn County is still being counted as one death by the Tennessee Department of Health. There are 10 individuals who have fully recovered from COVID-19. I'm sorry, 11. I got on the wrong line, I'm sorry. There are 11 total McMinn Countyans fully recovered from COVID-19, and they're now reporting 103 positive tests from the onset of the pandemic. Now we do know the large increase that we saw early last week and the weekend before came from, and still a lot of these positives are coming from, one long-term care facility here in the city of Athens, and they are working directly with the Tennessee Department of Health to make sure that they are being taken care of, that they're taking all the proper precautions as they should during this time with their staff and with their residents. And so we remain on call for that facility, for police, fire, our first response. We will be there. There will be extra precautions to protect not only the people on site, their health, but to also protect the health of our first responders, our firefighters, our police officers. And so we've gone an extra measure just to make sure that we're being as safe as possible and to do our part in preventing the spread of COVID-19. So 103 total. The good number here in McMinn County, and we continue to lead in this way. I'm proud of you Athenians for getting out there and getting tested and continuing to make sure you take advantage of that. Is 1,639 total negative tests in our community. 1,639 negative. And so that's wonderful, because we need to know whether people have it or do not have it. And we need to be able to quarantine and isolate the people who have it so they can get through that period of time and recover. That we want to make sure that we're paying attention to our healthcare assets here in the community. How many hospital beds do we have? Do we have the nursing staff available to take care of our positive tests if they need acute care, if they need to go an extra measure and they're having trouble recovering at home and they actually need admitted? We're seeing largely that the COVID positives that have come over the last week, and there has been a huge increase. There have been a huge increase in just the last several days, and a lot of that is because of the prison population now being tested, just like our long-term care facilities being tested at a higher rate. Making sure that those 700 facilities, as far as the long-term care, the nursing homes, those 700 facilities, those 70,000 Tennesseans that are in those facilities are getting tested. We know locally that a larger percentage of that population that is COVID positive is asymptomatic. And we're seeing the same issue in the prison system. A lot of COVID positive tests in the prison system, yet that population is largely asymptomatic. That means they're showing no signs, no symptoms. They don't have the scratchy throat, the cough, the things that we were told early on to be looking for, the fever. They don't have all of those symptoms, yet they still are carrying COVID-19. And our importance here, what we all have to be mindful of, is that we may be asymptomatic. We may not have the symptoms. We may not know or have any reason to suspect that we have COVID-19. So we need to get tested, and we need to be able to identify that, in fact, no, we don't have it, because the danger is the possibility of us unwittingly, unknowingly, passing COVID-19 on to a person with a weakened immune system. And we do know that that is much more difficult, and that will likely wear on some of our hospital and acute care resources. It may even cause death, and that's what we want to be cautious about, is that we're not that person that gets somebody else sick or that causes certainly a death. So we are watching this. I know there's some other figures that are being reported from that long-term care facility, that life care facility here in Athens. But we've always stuck to the data sets that we know and that are proven here with the Tennessee Department of Health. And it's the way that they're collecting the data and showing it, and we're just reporting to you those numbers. And so we don't have any control over that, but we want to be consistent with what we're providing to you. And so good job, Athens, getting out there and getting tested. And we hope this has only been a slight increase in the last few days. It is increasing, but only marginally, and largely due to that one cluster that we've identified in McMinn County. So let's make sure that we continue to do our part by staying apart. Let's make sure that we're wearing our face masks when we're out in public around other people that we haven't been and that we haven't had sustained contact with. That we are wearing our face mask, that you're washing your hands appropriately each time. If you are going to work, you're coming home from work, as soon as you walk in the door, the first thing you do, you're washing your hands, you're shedding your clothes, putting new clothes on, washing clothes, taking extra precautions just to make sure we're protecting our family and friends. And that's what it's about. We do that because we love each other. We're a community that supports each other. We're the friendly city. We love our neighbors, and we're going to take care of you, and we're going to take care of each other by following those CDC guidelines and following our governor's executive orders and following the guidelines that are being put out by the White House as well. I know it's been a big conversation in the community about reopening the businesses. I know some businesses are choosing not to reopen right now because of the extra precautions that are needed to be taken, and that folks are not feeling that we're past this surge, past an increase, at a safe point where we can get back to some resemblance of what life looked like before the pandemic. And that's okay. That's your call. We are going to abide by the governor's executive orders because they are, and they carry the weight of law. and they supersede anything that we can do here locally in this city or in this county. So we are going to abide in those things. We have been in contact with the district attorney, and he made it clear that he's not going to prosecute people who are protecting their livelihood when someone 45 minutes away can legally do the same thing. But there is opportunities. There is an opportunity to prosecute people who violate the law still in other ways, and the DA has been clear with that communication as well. And so we want to make sure that everybody's doing their part, being responsible in protecting their health and the health of others. It's okay if you feel great and maybe even you're COVID negative. Maybe you've got tested. You still have to be cautious about where you're going, the people that you're around, and making sure that you're not contracting it and then transferring it to someone else unknowingly. And that's what we have to be cautious of at this time. So, great job, Athens, for doing your part. McMinn County, keep up the good work, getting tested, being responsible, socially distancing, and still limiting our trips. We can't do any kind of mass gatherings, no events, no festivals, nothing of that nature until at least May 29th by Executive Order number 30 of our governor. However, some businesses are allowed to do a phased-in approach of reopening, of restarting under specific guidelines. Our houses of worship were added to that this past Friday. So we are looking forward to this coming Wednesday of perhaps being able to go back to hair salons, nail salons, maybe a massage, things of that nature. But those practitioners and the staff of those businesses, as well as the customers, all have guidelines to follow. And they are posted on tn.gov, and we want you to be familiar with those, so that we know that we're doing the best we can to protect our health. Without our health, we have nothing. So keep up the great work, folks. Really appreciate the support, the love that I'm seeing in this community, folks doing the right thing. There are also a lot of folks coming into our community, utilizing these essential businesses that are not being cautious. And so while that is their decision to make, just as it is our decision to make to be responsible and to help protect other people's health, we have to make the best decisions we can for ourselves. And so there's all kind of guidelines, there's all kind of the executive orders, all kind of information to help us make good decisions so that we can get through this quicker. What we don't want is a relapse. This, instead of being a V shape where we kind of shut down things and come back, we don't want this to be a W where we shut things down, we come back, then we have a resurgence, and we got to shut things down again. We want to keep that from happening, and in order to keep that from happening, we have to get through this one time. Let's do it right. Let's get it right with the best information that we know, what our leaders and scientists, epidemiologists, the chief people, the knowledge base on this particular thing that we're going through right now. Let's pay attention to that, and let's abide in that. Let's be good to each other and for each other. So with that, I did want to share, before I leave you today, I had a friend share with me something that former President George W. Bush has a video out right now on social media, produced through his presidential library, I believe. But he had a beautiful message in that video, and I just wanted to share that with you before we close out today. And what I'll do is I'll just actually read that message to you. And so this again is President George W. Bush's words, not my own, but it is a beautiful message that reminds us of this great nation in this time that we're in right now. This is a challenging and solemn time in the life of our nation and world. A remorseless, invisible enemy threatens the elderly and vulnerable among us. A disease that can quickly take breath and life. Medical professionals are risking their own health for the health of others, and we're deeply grateful. Officials at every level are setting out the requirements of public health that protect us all, and we all need to do our part. The disease also threatens broader damage, harm to our sense of safety, security, and community. The larger challenge we share is to confront an outbreak of fear and loneliness, and it is frustrating that many of the normal tools of compassion, a hug, a touch, can bring the opposite of the good we intend. In this case, we serve our neighbor by separating from them. We cannot allow physical separation to become emotional isolation. This requires us to be not only compassionate, but creative in our outreach. And people across the nation are using the tools of technology in the cause of solidarity. The disease also threatens broader damage to harm our sense of safety, security, and community. And I read that last part because it is so impactful. These few words speak volumes about what we're all dealing with right now. We're isolated from our best friends, from family members, from our loved ones. And thankfully, we have technology that can still bring us together safely from a distance. I hope you're calling your friends, your family. I hope you're checking on them. I hope you're using video so that you can see each other's faces during this time and provide that emotional support to each other while we are separated by distance. This is our time to shine, to be together apart. May God bless you. May God bless the city of Athens, and may the 4th be with you.